Good morning, everybody. Every friend from the Ontario College of the Traditional Chinese Medicine, invited by the Professor Wu, I'm very pleased to have the opportunity to give the lecture about the topic of inherence of the academic thought of Professor Deng Tietao, the master of traditional Chinese medicine. Today is the 14th August 2022. I'm Tiejun Tang from London. First, let me briefly introduce myself. I get my bachelor degree of the Chinese medicine in Heilongjiang University of Traditional Chinese Medicine at 1984. After I qualified, I joined the army and worked at Xijing Hospital of the 4th Military Medical University in Xi'an. After 5 years, I continue my study in the 1st Military Medical University in China, get my master degree in 1992. After master study, I worked at the 1st Military Medical University as a lecturer for 3 years. And from 1995 to 1998, I studied in Guangzhou TCM University for my PhD. My tutor is Professor Deng Tietao. After 3 years, I entered the Sun Yat-sen University of Medical Science. That is now currently called Zhongshan University. I do my postdoctoral research for 2 years. Since 2005, I came to London and work in the Middlesex University's teaching hospital called Asante Academy of Chinese Medicine. After 2013, and I work in the Park Clinic of Middlesex University. And currently, I work in privately as at London know-how acupuncture. Today, let me introduce about Professor Deng Tietao, my tutor. He's the national TCM master. He's born in 1916 and passed away at 2019, January. He's the lifetime professor of Guangzhou TCM University. Professor Deng Tietao. Here is in Cantonese, they use T-E-N-G. Deng is spelled as T-E-N-G in Hong Kong and Cantonese, but in Mandarin is D-E-N-G. That is not mistake, just this is Cantonese spelling and this is Mandarin pinyin. Professor Deng, born in 11th October 1916 in Guangdong, China. His father, Mr. Deng Mengjue, was a renowned TCM master in South China. He started to learn TCM from his father when he was a little boy. So this picture shows his hometown is Kaiping County, just here. Kaiping, and here is Guangzhou, and here is Hong Kong, he's Macau. He studied Chinese medicine in Guangzhou and used to practice in Hong Kong for some years. He studied TCM in Guangdong TCM School from 1932 to 1937. So you may notice that it's called TCM school, but actually it's a full-time 5 years program from 32 to 37. Same like currently TCM University in China. But in the 1930s, no TCM University, even college, they called a school. So in that school, Professor Deng got a training of Chinese medicine and Western medicine. He learned from TCM from very famous master, including Chen Yueqiao, Guo Yaoqing, and Xie Gengping. All are very famous in Guangdong province. From 1937 to 1949, he practiced and teaching Chinese medicine in Hong Kong, Wuhan, and Guangzhou. After he qualified, he practiced in Hong Kong. At that time, is the anti-Japanese war, and since Hong Kong has occupied by Japanese, he have to move to Wuhan. Everywhere in many places, cities are occupied by Japan, so he have to travel in different places as a private practitioner. In the 1950s, since 1950s, he teaching and practice in Guangzhou TCM school. From 1956 to 95, teaching and practice in Guangzhou TCM college. And after 95, this college changed the name to Guangzhou TCM University. Actually, the school and the college and the university is the same things, just change the name. So he always practice and teaching whole his life in Guangdong province. Professor Deng used to visit and deliver lectures in Japan, America, Canada, Singapore, Malaysia, Hong Kong, France, and Australia. So he used to be Mongolia in the 2004. Yeah. These are the published books from Professor Deng Tietao. Just a part of his book. He has published a lot of books and academic papers. So, and this is English publication. Yeah. Practice diagnosis in the traditional Chinese medicine. Yeah. So if English speaker, you can get these books to read. This is Deng Tietao Square. Tietao Square, it is 82 meters long from east to west and symbolize his 82 years of TCM practice. This studio is 3.5 meters high, which synthesized his 35 books of TCM. So he already published 35 books. This is at Tietao Square in Guangdong, Guangzhou. Outside of Guangzhou, there is a small town called Chonghua, not too far from my university in Guangzhou. Most of the time I work in the South Medical University. So this Tietao Square just very close to my home. Yeah. I became Professor Deng's PhD student in 1995 and qualified in 98 as with the PhD degree. This is my PhD presentation. And this is my postdoctoral presentation at 2000. So under Professor Deng's supervision, I finished my PhD research at this topic. The experiment study of casein capsule in improving myocardial ischemia and atherosclerosis. That is in 1998. This link, if you click this link, you can read the English abstraction of my presentation. And this is in the China's National Laboratory. My paper was sold on this website. This is the reference letter of Professor Deng wrote for me to recommend me for my postdoctoral research. I dedicated to study Professor Deng's academic thought and clinical experience since I became his student. After only 3 years, I follow Professor Deng, but so after qualified, I always keep contact with my tutor, and every year go to his home. When I come to UK, each time when I back to China, I must visit my tutor. And that is, I meet him at 2014, that is 2018, which is the last time I show him. That is already in the hospital. So this is a speech in the New Zealand, Australia, New Zealand, Auckland, New Zealand, in the 2016. I delivered a speech to introduce Professor Deng's academic thought and the clinical experience at metabolic syndrome. As for the key points of Professor Deng Tietao's academic thought, I would like to introduce 4 items. Number 1 is integrated Shanghan and Wenbing in his clinical practice. Number 2 is phlegm and stasis theory in treating cardiovascular disease. Number 3 is tonified qi and benefit spleen theory in treating the myasthenia gravis. The last one is the unique clinical experience in Lingnan local herbs. Let's see one by one. Firstly is integrated Shanghan and Wenbing in his clinic practice. So Professor Deng is in his clinic diagnosis and treatment, he always integrated Shanghan and Wenbing together, combine them together, not only use Shanghan or use Wenbing. As a TCM practitioner, when we study at university, Shanghan and Wenbing was taught by 2 different departments. We have a Shanghan Research Teaching and Research Department and Wenbing Teaching and Research Department. So when we learn Shanghan, the teacher always told us Shanghan is so important, is so efficient. And when we learn Wenbing, the teacher will also told us Wenbing is so important and very, very effective. But which one is the best? Of course, we need to learn both, not only Shanghan and Wenbing, and also Neijing, and also many other famous masters in TCM history. So I think both Shanghan and Wenbing all have their advantage and some disadvantage. So Professor Deng, he's not only a master of Shanghan or a master of Wenbing. He integrated Shanghan and Wenbing together. Take example. In the early stage of SARS, Professor Deng used modified 麻杏石甘汤 and 生姜散. So, in the 2003, SARS start from Guangzhou, actually, from Guangzhou, and then Hong Kong, and then Beijing, and gradually many provinces in China. So in the spring of the 2003, and Professor Deng, he's the leader of the TCM specialist group of the whole country. Under his supervisor, SARS was finished just in a couple of months. Yeah, it started at the beginning, maybe January and February. In Guangzhou, it finished at maybe at May. Yeah. In Beijing, maybe June. So just less than half a year. So the whole China SARS was finished. So not like currently this COVID. So it's already nearly 3 years. Still have. When Professor Deng treating the SARS at the early stage, he used the 麻杏石甘汤 and 生姜散. So 麻杏石甘汤, everybody should know it is from 伤寒论. 麻黄 and 生石膏, 草杏仁 and 炙甘草. The top 4 is 麻杏石甘汤. And 麻杏石甘汤 is from 张仲景, from his book 伤寒论. And 生姜散 is the famous Wenbing's formula. 白姜蝉, 蝉蜕, 蒲黄. Actually, 生姜散 only 4 ingredients. Another is 大黄, which is removed. So, except 大黄, these 3 all from 生姜散. And 薄荷, 连翘, 金银花, that is from also is from Wenbing master, 银翘散. So it's a part of 银翘散. 芦根 also is part of 银翘散. 薄荷, 金银花, 连翘, 芦根, that is from 银翘散. 银翘散 and 生姜散. 生姜散 is a famous formula for treating the pandemic disease. And 银翘散 from Wu Jutong, a Wenbing master. It's from experience wind heat syndrome. So in this formula, it contains Shanghan and Wenbing together. In the later stage of the SARS, Professor Deng used modified 青银汤 and 生脉散. 青银汤 is a famous formula in Wenbing, but 生脉散 is from Shanghan. So half is Wenbing, half is Shanghan. So 青银汤 and the important ingredient is 犀角. Of course, we are not allowed to use 犀角. In China, we still can use 水牛角. So you see, Professor Deng used 水牛角 30 grams to replace 犀角. 犀角 is an endangered animal. We are not allowed to use them. And 水牛角, 生地黄, 玄参. So that is from 青银汤 and 金银花, 西洋参, 麦门冬, 山茱萸. So 西洋参麦门冬 that is from 生脉散. 生脉散 is 人参麦冬五味子. Here Professor Deng uses 山茱萸 to replace 五味子. So that is modified 生脉散 and modified 青银汤. Professor Deng used this formula to treat in the later stage of SARS. In the recovery stage of SARS, Professor Deng used modified 生脉散 and 沙参麦冬汤. Again, so 生脉散 from 伤寒 and 沙参麦冬汤 from 温病. Let's see the formula. 太子参, 沙参, 麦门冬, 扁豆, 炙甘草, 山药, 玉竹, 法半夏, 芦根. So that is modified some ingredients from 生脉散, some ingredients from 沙参麦冬汤. So that is from this example of the SARS treatment, we can notice Professor Deng's in his prescription. So not always use 伤寒 or 温病. I think maybe many of you have heard about currently the Chinese government recommend 3 formula and 3 medicine or patent drugs. So 3 formula recommended by TCM administration of China is most important is 清肺排毒汤. In 清肺排毒汤, if you analyze its ingredient, in total it has 21 ingredients. 21 ingredients, but if you analyze, it contains 4 or 5 different formula, but all from 伤寒. 麻杏石甘汤, 麻杏射甘汤, 五苓散, 小柴胡汤, and 二陈汤, all included in 清肺排毒汤. But if all of these formulas came from 伤寒, nothing from the 温病. But actually, for pandemic treatment, many 温病's formula is very important. So that is my opinion and also Professor Deng's opinion. So Professor Deng passed away at January of at the beginning of the 2019, and COVID-19 came at the December of the 2019. So I just sometimes I just think about if Professor Deng still alive, what prescription he will give. I think probably he will give similar prescription like 17 years ago when we fight in the SARS. So that's why when I treating the COVID-19 patient, I always review the Professor Deng's book and his clinical experience when he treated the SARS. You know, SARS and COVID are very similar. They are the structure of the virus, and they are receptor at the surface of the virus. When they enter the human body, they always share the same ACE2 receptor. So the clinical symptoms is very similar. And so I think the treatment principle should be similar. So when we treating the COVID is not finished at the moment, but still have some case. So we should follow Professor Deng's experience to remember some clinic experience when he fighting the SARS. We use his clinic experience and to treating the COVID. So in my practice, I get a very good effect. So because the time is limited, we don't talk in this. I used to talk in this in another international conference, talking this in English. So maybe you can find the later video to have a look. And the second point of Professor Deng's academic thought is phlegm stasis theory. Phlegm and stasis theory in treating cardiovascular disease. Professor Deng believes phlegm and stagnated blood are key points of pathology of coronary heart disease. Coronary heart disease is very common. In the world, cardiovascular disease is the first killer. So many people died of heart attack. So which formula is the best to release myocardial ischemia, to improve the coronary circulation? So that is very important. So many people believe coronary heart disease is due to blood stasis in the chest. So many people use 血府逐瘀汤 so to remove blood stasis, especially for some people qualified from the Western medicine. When they think about the release the coronary heart disease chest pain, they just think about, so because the artery is obstructed by thrombus, so we need to remove the thrombus, use the remove blood stasis. So that's why they use 血府逐瘀汤. And some people use the Senisa. Some people use 麝香保息用丸. So different practitioner may have different experience. And Professor Deng's experience is based his analysis of the pathology change. So he believed the pathology change of the CHD is spleen deficiency produced phlegm. The phlegm and blood accumulation, that is the key points of the pathology. So because this pathology change, the treatment principle should be benefit spleen and regulating qi, expel phlegm and remove blood stasis. Based on this treatment principle, Professor Deng usually select Wendan Tang modified. Wendan Tang. So let's see the Wendan Tang first. In the history, rather two different Wendan Tang before. 孙思邈 is in his book 千金药方 has 温胆汤 we call it 孙氏温胆汤 that is in the Tang dynasty 1000 years ago and in the Chen Yan that is the Ming dynasty in his book 三阴及一病症方论 his 温胆汤 is we call it 陈氏温胆汤 and Professor Deng's 温胆汤 so we call it Deng's 温胆汤 so Tang dynasty read Sun Simiao's 温胆汤 and Ming dynasty at Chen Yan's 温胆汤 so what's the difference Sun's 温胆汤 from 孙思邈 it used 半夏竹茹枳实橘皮生姜甘草 and Chen Yan's 温胆汤 use 半夏陈皮竹茹半夏竹茹 is the same like 孙思邈 but 枳实 also same 陈氏温胆汤 change 橘皮 to 陈皮 and add 茯苓 just add 茯苓 甘草 is exactly the same and Professor Deng's 温胆汤 is 半夏竹茹枳壳 he used 枳壳 to replace 枳实 that is the difference you know 枳实 is more into the function at the middle jaw at gastrointestinal system but 枳壳 is remote stasis from the chest more works on the upper jaw at heart and lung so that's why Professor Deng used 枳壳 to replace 枳实 and used 橘红 to replace 陈皮 橘红 and 陈皮 is similar but still quite a lot of difference 橘红 in Guangdong province 化州is produce the best 橘红 so 橘红 is the price is much higher than 陈皮 and also the quality is much better than 陈皮 and to remove the phlegm for the function of expel phlegm 橘红 is much better than 陈皮 so that's why Professor Deng used 橘红 to replace 陈皮 and he except 茯苓甘草 he added another 2 ingredients one is 丹参 the other is 党参 so many research pharmacological research has showed 丹参 has good function for coronary heart disease it has good function to remove blood stasis in the coronary artery and dilate the coronary artery and increase the blood supply of the heart so it has good effect for treating coronary heart disease so that's why 丹参 was added let's look at this is 邓氏温胆汤 so 竹茹枳壳橘红半夏茯苓甘草丹参党参 so I add a Latin name in here so if you have the patient suffer from the coronary heart disease like angina you can try this formula so that is 枳壳 and 枳实橘红 and 陈皮 so that is different my PhD research is just the focus on the coronary heart disease use Professor Deng's formulas to treating the improved myocardial ischemia so I spent 3 years to work on this topic so That's why I have quite deep understanding about Deng Shi Wen Dan Tang. So Wen Dan Tang, if you from the name of the formula, just warming the gallbladder. So maybe some people think, oh, warming the gallbladder, why it can treat in the heart disease? So actually, not only warming the gallbladder, not that simple. After modified, inside the Wen Dan Tang, many ingredients is for expel phlegm, like 半夏, 竹茹, and Fulin for expel dampness. So, and Juhong also for expel phlegm. So remove the phlegm just because Professor Deng believe it is phlegm and blood obstructed together. So causing the meridians or heart meridians obstructed. So only by expel phlegm, we can benefit the heart. So Deng Shi Wen Dan Tang is good effect on, we can't say on every coronary heart disease, but more than half of the coronary heart disease. So if your diagnosis is the phlegm and obstructed blood, so we can try Deng Shi Wen Dan Tang. I have many successful clinical case. Again, because the time only have 2 hours, we don't have time to discuss in detail. Just recommend. So Deng Shi Wen Dan Tang for coronary heart disease treatment. Of course, if this chronic coronary heart disease is already heart failure, we need to do more modified. Maybe we need to add Wuling-san something. And if already have arrhythmia, irregular heartbeat, we need to add 炙甘草, big doses of 炙甘草, and sometimes maybe 麦门冬, 五味子, and just modified 生脉散 for arrhythmia. And if only angina, we can use Wen Dan Tang, Deng Shi Wen Dan Tang, and also even no chest pain. Just some people have a high cholesterol. High cholesterol, that is a high risk of the heart disease. So some people have hypertension, blood pressure a little high, and their cholesterol is a little high. Wen Dan Tang also works well. The third points of the Professor Deng's academic thought is tonified qi and benefit spleen theory in treating myasthenia gravis. Myasthenia gravis is the muscle weakness. In Chinese, we call it 重症肌无力, myasthenia gravis. Muscle weakness. In TCM's theory, muscle was dominated by spleen, right? Yeah, that is the basic theory of TCM. So muscle was dominated by spleen. So if the muscle weakness must be spleen deficiency. So the treatment principle should focus on tonified qi and benefit spleen. So because this analyze, Professor Deng used 强肌健力胶囊 to treat in the myasthenia gravis. 强肌健力饮。强肌 mean strengthen the muscle. 健力 mean benefits the energy. So the ingredients are following. 黄芪 60 gram. 五爪龙 60. 党参 30. 白术 15. 柴胡 10. 生麻 10. 当归头 10. 陈皮 3 gram. 炙甘草 5 gram. So let's analyze this formula. 黄芪 is qi tonified. Use the big doses, quite high doses, 60 gram. 五爪龙 also is qi tonified. Maybe everybody know Huang Qi is qi tonified, but very few people have used the Wu Zhualong before. Wu Zhualong is a local Cantonese herbs. Later, I will introduce this form, these herbs. That is Professor Deng's favorite herbs for using for treating the qi deficiency. And Wu Zhualong also called Nan Qi. You know, Huang Qi, the best Huang Qi is produced from North China. So we call it Bei Qi. Bei means North China. But Wu Zhualong is only produced in Guangdong province. So we call it Nan Qi, South Huang Qi. So for tonified qi, Wu Zhualong is similar like Huang Qi, but not as hot as Huang Qi. You know, in Guangdong province, the weather is hot. Some Cantonese people if use too much Huang Qi to produce heat. But Wu Zhualong, it can tonify the qi, but never produce too much heat. And Wu Zhualong has many other functions we will introduce later. 党参 白术 they all have qi tonified function. So tonified qi and benefit the spleen and the stomach. 柴胡生麻 for lifting qi, just ordinary doses. 当归头 is blood nourishing. You know, Dangui, different part of Dangui have a slightly different function. Dangui Tou more tonified blood, and Dangui Wei or tail of Dangui more tend to remove the blood stasis. Chen Pi for remove the qi stagnation. Gan Cao for harmonize the whole formula, and Gan Cao itself also have a little function of qi tonified. That is 强肌健力饮. This formula, maybe if you think about it's based on which patent, which classical ancient formula. So many people may be found that is a modified 补中益气汤, right? So 补中益气汤 just add, actually just 补中益气汤 add 五爪龙. Yeah. So 补中益气汤 is a very famous formula from Li Dongyuan. Li Dongyuan from Jinyuan dynasty. Yeah. So 补中益气汤 is widely used in treating many spleen qi prolapse and deficiency. So Professor Deng is very like to use Li Dongyuan's formula, not only 补中益汤 but others the formula from Li Dongyuan. So, and 强基健力胶囊 is modified from 补中益气汤. Most important is the doses about 黄芪 and 五爪龙. So this is published paper. From the published paper, the doses is 60 gram. But in the clinic, when Professor Deng treating the 重症肌无力 now, so mild asthenia gravis, the doses of 黄芪 is even more than 60, sometimes can be 100 and even more than 100 gram. So can be very huge doses, and 五爪龙 also is very huge doses. So as for the doses of 黄芪, Professor Deng has a lot of unique experience. Yeah, when he treating this condition, the 黄芪 can be very big doses, very common. 60 is the 60 gram is the minimum. Sometimes can be over 100. And if he use 黄芪 for just the 御砭风散, for prevent cold, 黄芪 can be small doses, and 白术 can be big doses. 白术 doses must be equal to 黄芪 and 防风. So that is Professor Deng's clinical experience. And when he used 黄芪 to reduce the sweating, can be small doses. And he also believed for hypertension, blood pressure, small doses of 黄芪 can increase the blood pressure, and big doses of 黄芪 can reduce the blood pressure. So sometimes for treating hypertension and hypotension, the doses of 黄芪 should be different. So the 黄芪 can be from 5 gram to 50 gram and even 100 gram. So different condition, he used different doses. And because Professor Deng's contribution, his achievement, and his research group have get this prize. Yeah, on the second prize of National Science and Technology Progress Award in 1992. Yeah, in Chinese we call it 国家科技进步二等奖. So Professor Deng has in total he has 15 PhD students. I'm his number 5. Yeah, the first and second PhD student is focused on this topic, this research, just Chinese medicine 强基健力饮 treating the myasthenia gravis. So from the third and fourth and me, yeah, we focus on the coronary heart disease. So, but this is a very important research and get a very good second prize of the National Science and Technology. And next, I would like to introduce the unique clinic experience in Lingnan local herbs. What is Lingnan? So if Chinese people, maybe many people understand, oh, Lingnan just the South China part of but actually Lingnan it including Guangdong province Guangxi province, and the south part of Hunan province, and the west part of Fujian province, and North Vietnam and Hainan province. So in ancient time, all these areas called Lingnan. Lingnan area is probably the hottest part in China. So the weather is hot and dampness. So the TCM treatment, we must think about the weather and geographic factors. So when we treating the disease, we should use more herbs for clean the heat and expel dampness. So Professor Deng, in his clinic experience, many herbs always focus on the dampness and heat, clean heat and expel dampness. Okay, you know, China is very big. From south to north is a totally different weather and geography. And in North China, it's more cold. And in the South China, much hot and more dampness. So the TCM treatment, we must consider the weather and geographic factors in our treatment. So I used to study TCM in Heilongjiang province, northeast China. You know, Mr. Wu Binjiang, just we are same qualified from the same university. He's 1 year earlier than me. You know, in my hometown is near Russia, you know, near Russia and North Korea. It's very cold. So, but after qualified, I practiced in the Northwest China, in Xi'an city for 5 years. And then most of my working practice time is in Guangzhou, which is near Hong Kong. So in Guangzhou, I practiced 16 years in Guangzhou. When I learned TCM in North China, in Harbin, many herbs I never learned. We just learn some herbs which is produced and commonly used in the North China. In the South China, some herbs we didn't even learn, you know. So there's a few thousand Chinese herbs. It's impossible to learn everyone. So we only learn a few hundred, that is enough. But actually, the number of Chinese herbs is more than few hundred, actually it's thousands of herbs. So when I came to Guangzhou, especially when I followed Professor Deng, I noticed some herbs he used, I have never heard. I have never learned and even never heard about it. So most commonly used for his prescription, nearly, we can't say every formula, but more than half of his formula, he used Wu Zhua Long, like this, just this formula. He used Wu Zhua Long for qi tonified. For tonified qi, Wu Zhua Long is the first choice. So what is Wu Zhua Long? Wu Zhua Long, also called Wu Zi Mao Tao. Wu Zi mean 5 fingers, you know, 5 fingers, 1, 2, 3, 4, 5. You see, because the leaf is like 5 finger, yeah, always 5 like this. Wu Zi Mao Tao. And the nature is mild warm, not as warm as hot as Huangqi. It's mild warm, suitable to Cantonese people and people living in the Lingnan area. Sweet, the taste is sweet. Into the lung and spleen, the function is invigorating the qi. So it called sauce Huangqi. Benefit the lung and spleen, and also it has another function which is Huangqi didn't have. That is expire, wind damp. So, Huangqi can tonify the qi of a whole body qi, can tonify the spleen qi to benefit the spleen, and also tonify the lung qi for release the cough and qi deficiency of the lung. And Huangqi has another function, a later function for expire the urination and dampness, promoting the urination and expire dampness. So that is Huangqi. But Wu Zhualong, the qi tonified function is similar like Huangqi, but not produce too much heat. And another function is expire damp, wind damp. Wind damp. So it can treat in some B syndrome. B syndrome like mean joint pain, no matter the joint is a small joint or big joint. So except qi tonified and also suitable for some joint pain, which is due to wind heat and wind damp. So this is Wu Zhi Mao Tao or Wu Zhualong. It looks like this. This is Professor Deng's handwriting. So Wu Zhi Mao Tao 又称Wu Zhualong. I mean Wu Zhi Mao Tao also called Wu Zhualong. 健脾补肾，补而不燥 benefit spleen and tonified lung, tonified without produce dryness, even tonified qi, but never produce too much heat and dryness. That's from Professor Deng's handwriting. So the second point is Deng category is first choice for B syndrome. B syndrome actually is arthritis. Different kind of arthritis can be rheumatoid arthritis, can be osteoarthritis, can be some injury, sports injury arthritis. Different kind of arthritis, but especially rheumatoid arthritis is usually due to 3 evils mostly, which is wind, cold, dampness, 3 evils. So, and sometimes can be accompanied with the heat. So especially in the Lingnan area, sometimes can be damp heat causing the joint pain. We call it B syndrome. In South China, more damp heat in South. The B syndrome's more heat than cold. Professor Deng often select Deng category to treat in the B syndrome. Deng, what is Deng? T-E-N-G. Deng means wine or Cadiz family plants. Cadiz family plants. So it's always in Chinese, it's landed at Teng, T-E-N-G, like Huan Jin Teng. You see, Cadiz colitis always has colitis. Yeah, colitis family plants. 清风藤、海风藤、落石藤、忍冬藤、积雪藤、夜交藤、石南藤、鸡石藤、雷公藤。You see, so many herbs all landing at Teng, T-E-N-G. So maybe 鸡血藤 you often use them. 鸡血藤、夜交藤、鸡血藤, and it's commonly used. But some others is not very common. 宽金藤 actually is a Tibet herbs. It's not original from the central China. It's from Tibet. We call it 宽金藤. Professor Deng often liked to use 宽金藤 for treating the joint pain and also some muscle ache. Yeah. So 宽金means wider the tendons and the ligament. So 宽金藤. 清风藤, 海风藤. I know some practitioners often select these two herbs for treating arthritis. And 清风藤 in Germany, as a company just use 清风藤 to obstruct some chemical substance and make into like a Western medicine to treating arthritis, but actually it's obstructed from 清风藤. You know, German has some pharmacologist is very just focus on some research of the nature plants to develop the new drugs. So 清风藤, that is one of their research. And 忍冬藤, 忍冬藤 just 忍冬就是金银花. You know, the flower is 金银花, but the root, the branch, we call 忍冬藤. 金银花, we use 金银花 to experience wind heat syndrome, even including COVID treatment. We often use 莲花, 连翘, 金银花. But the branch of 金银花is totally different. We use this for treating the joint pain, treating the B syndrome. 雷公藤 here, it used to be very popular in the 1980s, 1970s. It's very popular to treating the arthritis, and currently still have some research about 雷公藤, but 雷公藤 has been found it can have a steady effect of the damage the kidney function. Sometimes use the too long-term use 雷公藤 causing kidney function damage. So we should be careful. Yeah, don't use 雷公藤 too much doses or too long term. So the B syndrome can be due to damp heat, can be some due to damp heat, some due to damp cold. So for damp heat, 宽金藤、落石藤、忍冬藤、鸡石藤、西茜草、威灵仙 is suitable to treating the joint pain due to damp heat. And if due to damp cold, 清风藤、海风藤、石南藤、鸡血藤、生金草 and 木瓜 suitable for damp cold syndrome. How can you know that the joint pain arthritis is due to damp heat or damp cold? You know, if damp heat, the patient must have some heat syndrome, like a rapid pulse, yellow tongue coating, yeah, red tongue with yellow coating, and constipation, yellow urination, and sometimes the joint pain a little swollen and red, the skin tend to red. Let's indicate damp heat. And damp cold is opposite, aversion to cold, and the joint pain getting worse in the cold weather. Yeah, and also slow pulse, pale tongue with white coating. So that is more cold, more dampness and cold. So analyze the patient, the joint pain when you're treating arthritis. So analyze is more heat or cold. If more heat, use this category, use the least term. And if more cold, use this term. So not always use the term category, but also sometimes use 西茜草, that is herbs. It's no 西茜草. And like this 生筋草, just herbs. 西茜草 recently, just last year, I read the publication by a magazine and also in some newspaper in UK has found the mechanism about anti-arthritis. 西茜草 in the Western country still have some research, pharmacological research about 西茜草 treating the anti-rheumatoid function. The next is we call it 针缝 is the first choice for Lin syndrome. What is Lin syndrome? What is a 针缝? 针 mean 珍珠草 is one herb. 凤 mean 小叶凤尾草. Another local Lingnan herbs. Lin syndrome is actually just a urea tract infection. We call it UTI. UTI is quite common, especially for female. It's easy. Some people said nearly every female in the whole life must have one or two, a few times UTI, urea tract infection. Some people even get it very often. Yeah, every year I have a few times. So in the Western medicine treatment, UTI always given antibiotic, but sometimes it works. After a few doses, maybe a couple of days, it's cured. But sometimes it doesn't work. Why it doesn't work? Because the bacteria get the resistance to antibiotic. First time it works. Second time when you use it, less working. The third time can be no function. So it doesn't work. In this condition, we can use Chinese medicine, Chinese herbal medicine. Most commonly used patent formula should be 八正散. 八正散. If you have learned TCM for some times, you should have remembered. Maybe many people are very familiar with the 八正散. 木通车前扁蓄巨麦灯心草车前子. So that is 八正散. And Professor Deng he preferred to use 珍珠草 and 小叶凤尾草. So that is 珍珠草. 珍珠草 also called 苦味叶下珠. Why it called 叶下珠? You see, like a pill under the leaf. Under the leaf, rather like this, like a pill. 珍珠, just like a pill, a small pill. This herbs is cold, sweet, and bitter taste into the liver and lung meridian. The function is clean away the heat, promoting the urination and the detoxification. In China, some people use this for treating the hepatitis as well. It's not only for antibiotic, but also has some function for inhibit the hepatitis virus. 小叶凤尾草 yeah. Looks like this. 小叶 means small leaf. 凤尾草 is because this leaf looks like a tail of a phoenix, so called 凤尾草. It's cold in nature, mild bitter taste into the kidney and the stomach. It can clean away heat, expel dampness, and detoxification. That is 小叶凤尾草. Urea tract infection is very common. It is estimated that half of all women in the UK will have UTI at least once in their life. The symptoms is frequent, urgent, and painful urea, and a burning sensation when urinating. Urea color appears darker or cloudy. The treatment is antibiotic. The problem is resistance. The solution is Chinese herbal medicine. So about 珍珠草 and 小叶凤尾草, I did a laboratory experiment to approve why it works. I used the microbiology technique to approve 珍珠草 and 小叶凤尾草. These two herbs separately used and combination used together. So the effect on the bacteria, the effect inhibit effect for bacteria. So it shows combine 珍珠草 and 小叶凤尾草 has get the best effect. Number 4 is the target the reasons to release pain. Pain is should be the most common symptoms. In many diseases, patients have pain here and there, but different part of pain, different kind of pain. Professor Deng select different herbs. For example, he prefer to use 两面针. 两面针 in Professor Deng's prescription, it's always written 入地金牛. 入地金牛 actually that is 两面针. It's mild, bitter taste and pungent into the liver and the stomach meridian. It has a function for activating the blood circulation, remove the qi stagnation, and release pain. For stomachic and gum pain, if the pain is at the gastrointestinal system, especially in the stomach area, he often use 入地金牛. And the gum pain is usually due to the gum infection. The most common formula for gum infection is 清胃散, right? 黄连, yeah, 清胃散, 生麻, 黄连, 生地, yeah, 牡丹皮. For gum infection, just recently I have a patient, she suffered from the gum infection, the swollen and very painful at the gum. You know, the gum is a stomach meridian is travel from Yingxiang, no, sorry, for Dichang and Daying and Xiache. So that is a stomach 456, right? So that is stomach meridian infection. So we use 清胃散, and for pain release, Professor Deng often use 入地金牛 or 两面针. And 旧必应 is another herbs. It's cold and bitter taste. Enter the liver and the lung and the large intestine meridian. The function is clean heat and detoxification. For abdominal pain with diarrhea due to damp heat, he often use 旧必应. You know, the diarrhea due to damp heat, patients often have abdominal pain, diarrhea, and the stool can be watery, and yellow and very frequent, maybe more than 10 times per day, very frequent diarrhea. So the yellow tongue coating, red tongue with yellow coating, slippery and rapid pulse. Everything is indicate damp heat. It can be just a colitis or dysentery. Xu Changqing, in Professor Deng's formula, he always written 了雕竹. You know, 了雕竹, just because the herbs looks like this, like a Chinese letter, 了 and 雕, so called 了雕竹. 了雕竹 is because it looks like 了 and 雕. The former name is Xu Changqing. Professor Deng often used these herbs to release the joint pain, injury pain, and dysmenorrhea. That is period pain for women. In nature, is warm and pungent. Liver selection, meridian selection is the liver and the stomach. So joint pain, we have mentioned he often use different kind of 疼, 宽筋疼, 落石疼, 清风疼, 海风疼, 疼 category. At the same time, if very bad pain, so Xu Changqing is good choice to just for pain release. Yeah. 黑老虎 is the name mean 黑老虎 mean black tiger, but actually it's not related to tiger. Just looks like this. It's a herbs. In nature, it's warm. Flavor is pungent and bitter taste. Meridian selection is lung and kidney. So Professor Deng used this for injury pain, you know, dramatic injury, no matter it's a traffic accident or sports injury or repetitive strain injury, or called RSI. So different kind of injury. Yeah. 黑老虎 is good for release the pain due to injury. And next is 青天葵 for relieving the exterior syndrome, focus on the summer heat. We often use 青天葵. for fever and cough. The weather in the Guangdong province is very hot. So many people, many Cantonese people have the habit to drinking the cold tea, even no disease, just for health maintain. So many Cantonese, they must drinking cold tea during the summer. So Qingtiankui is very common ingredients of the cold tea, Guangdong cold tea. Maybe you have heard about Wang Laoji, Xia Sangju, and also Professor Deng have his formula called Deng Lao Liang Cha. So Huang Zhenlong, a different famous band, they are cold tea. Very bitter taste, but Cantonese always drinking this. Some people even drink it every day in the summer. If you don't drink it, you will easy to get summer heat, catch the summer heat. So Qingtiankui is an important ingredient of cold tea. Gangmeigen is another important ingredient. Gangmeigen, for thirsty and so salt. When the weather is very hot, people sweat a lot. After sweat and feel thirsty, and often have so salt. So Gangmeigen can release the so salt and release the thirsty. That is Gangmeigen. It's cold, bitter, and sweet into the liver, lung, large intestine meridian. Lonely Ye often combined with the Gangmeigen together. Lonely Ye, long means dragon, Li means tongue, Ye means leaf. So this leaf looks like a dragon's tongue. So that is why it's called Lonely Ye. It's suitable for release the cough and the fever. So it mild, sweet taste and bland taste. And the meridian selection is lung and stomach meridian. Lonely Ye. Professor often like to use Lonely Ye. It also, again, is a very common ingredient in Guangdong cold tea. Guangdong Liang Cha, cold tea. Buzha Ye is another important ingredient of cold tea. Buzha Ye. It is benefit the appetite, so treating for poor appetite. Buzha Ye is mild and so taste into the liver, spleen, and the stomach meridian for food retention. And Buzha Ye is good choice. And also Professor Deng used Buzha Ye to reduce the cholesterol. Some blood lipid high, hyperlipidemia. So Buzha Ye has a good function to reduce blood lipid. High blood cholesterol, high blood pressure, and high sugar level, diabetic, and overweight. If these four conditions happened in the same person at the same time, that is metabolic syndrome. So metabolic syndrome is quite common, especially in the Europe and US. So, some people, have eating too much and drinking too much and overweight, obesity. So very easy to get in the metabolic syndrome. If it happened, Western medicine will give many different kind of tablets. Maybe one kind is Deng for cholesterol, one kind of metformin for blood sugar, maybe at least one or two kind of tablets for blood pressure. So too many, few tablets for blood pressure, a few tablets for sugar, for blood cholesterol. So every chemical drugs getting some side effect. And this side effect can put together to make the things worse. It can damage the liver function, damage the kidney function. Of course, if you only take a few days or even a few weeks, it doesn't matter. But this medicine, they need to take it the whole life. They can't stop. If they start take one tablet, you must take it the whole life. If you stop the blood pressure tablets for 1 day and blood pressure, even one doses, you miss the one doses, blood pressure will rise up immediately. If you stop the statin, and the cholesterol will increase. If you stop the metformin or insulin, so blood sugar will rise up. So you can't stop anything. How can you take these tablets whole life? You only, the side effect is you can't avoid. Many people have to suffer from the side effect, liver function damage. So in this condition, Chinese medicine is good selection. So I used the delivery talk in the Netherlands, Amsterdam. So I gave them a whole day CPD about how to treat in their metabolic syndrome with Chinese herbal medicine, especially use Professor Deng's clinic experience. So they are very happy to, because they learn a lot. So for metabolic syndrome, if we said we use Chinese medicine to treating some, like myocardial ischemia or myocardial infarction, especially myocardial infarction, the patient must stay in the ICU or CCU. So in very dangerous condition. So maybe we don't have chance to treating this patient. But for metabolic syndrome, we meet the patient nearly every day. So very common. So 布扎叶 is good for cholesterol. Except 布扎叶, 决明子, also called 草决明, is another good selection for high cholesterol. Of course, 山楂 is good, 泽泻 is good, 荷叶 is good for high cholesterol. So, but Professor Deng, he used 布扎叶, which is a very unique experience. 独角金 独角金, maybe most of you never heard about this medicine. So do I. Before I followed Professor Deng, I never heard about what is 独角金. It is herbs for poor appetite. It's cool in nature, sweet and bland taste into the spleen and stomach meridian. Especially for small baby, if they don't like to eat, lost appetite, and also for even adult, and because the weather is too hot, no dessert to eat, lost appetite totally. So 独角金 is good. So it also sometimes can be an ingredient of a Cantonese cold tea, 独角金。树心花 is nourishing the heart shen with 树心花。Heart shen disturb often causing some sleeping problem. Sleeping problem including insomnia. Insomnia can be different. Some people it's difficult to fall asleep. Some people easy to wake up. After wake up and couldn't sleep. So interrupted sleep. Oh yeah. So that is a sleeping problem. And some people is sleeping too much. Like recently I treated a patient and she sleep too much. In the daytime, always sleepy. So no matter sleeping less or too much, or heart shen disturb, heart shen problem. So 树心花 is good choice to benefit sleep and release the liver qi stagnation. Liver qi stagnation, the common symptoms is depression, anxiety, anxious. Some just maybe simply just a stress mood. So we can use 树心花. Add 树心花 in 逍遥散. You know, 逍遥散 is very common, or 逍遥丸, very common for release the depression. Depression is very common in the Western country. I think no matter Europe or North American, so many people suffer from the depression. So depression is so common, no matter that you are rich or poor. So the poor because financial difficult, they depress. But very, very rich person, millionaire, they also have depression. So antidepressant, again, always causing side effect. Some people taking antidepressant and they feel more depressed. It doesn't work, and side effect. Some people even suicide. The depression can't causing people died directly, but many people kill themselves. So that is a big problem. So Chinese medicine, 逍遥丸 is good. I have just joined this talk. I have received a telephone call from one of my patients. She hoped to tomorrow will come to my place to collect some herbs, 逍遥丸, because her boyfriend just very bad depression. Yeah, can't stop take the Chinese medicine. So we can release the depression without side effect. And 树心花 can be added to 逍遥丸. Because you know, in my clinic, I have 逍遥丸. It's a different from traditional 逍遥丸. You know, 逍遥丸is original from Heji Jufang Song Dynasty, but my 逍遥丸 is modified. I add 树心花 inside, add some 玫瑰花. So it's different from the traditional 逍遥丸. I also call it 逍遥丸, but it's 逍遥丸for myself. So the effect, make the effect better than the ordinary 逍遥丸. So the modification is so important. Sometimes you just add 1 or 2 herbs. It can make you formula. We can't see the double of function. At least increased 20 or 30%. Yeah. 楚石子 is another herbs. Professor Deng liked to use 楚石子 for nourishing the liver and the kidney. nourishing the liver kidney with 处实子. 子 means seed, right? Seed, very tiny seed like this. Original herbs is like this. The nature is nourishing the liver and the kidney and benefit vision and promoting the urination. If you think about the first two functions, you may think about another very commonly used herbs, very similar one. That is 枸杞子. You know, 枸杞子 is so common. We use 枸杞子 every day. It can, no matter to treating the disease or prevent the disease or just benefit your health. So I often like 枸杞子. But 菟丝子 is very similar to 枸杞子. 枸杞子 also benefit kidney and liver and benefit vision. 枸杞子. So 菟丝子 we can see similar to 枸杞子, but at the same time it can promote in the urea. So that is the third function, promoting the urination. That is 枸杞子 didn't have. The top two functions is the same like 枸杞子, but the third functions, which is a unique function for 菟丝子. So benefit kidney and liver. You know, the old person often have liver and kidney deficiency in different degree. So if you're over 70s, over 80s, more or less you have kidney and liver deficiency. And the vision is not as good as a young person. So some people vision also reduced. And maybe for some old men, often have a enlarged prostate. So maybe a little high cholesterol, prostate enlarged, and broad vision, blood pressure a little high. That is so common. You know, the old person, nearly many people have such kind of conditions. So we can use 枸杞子, we also can use 菟丝子. Especially 菟丝子 can promote the urea. It's good for the enlarged prostate gland. You know, old men, the urination is sometimes can be difficult. Sometimes it's dropped urea. Some people more frequent, some people more difficult. So 菟丝子 is a good selection. Next is 火炭母. 火炭母, the original herbs looks like this. The function is clean away the damp heat, cooling blood, and detoxification. 火炭母. So for treating damp heat, if the damp heat is in the intestine, causing the diarrhea, abdominal pain, we can use 火炭母. If the damp heat is in the liver and gallbladder system, the patient can be hypochondriac area pain, can be have jaundice, bitter taste in the mouth, like a gallbladder infection. We can use 火炭母. If the damp heat in the ureteric, like a UTI, the patient have a frequent urination, burning sensation, painful urea, and that is like UTI. We can use 珍珠草, 小叶凤尾草, as I mentioned before. Of course, we also can add 火炭母 because it can have good function of clean away the damp heat. No matter the damp heat is happened in which system, it often works Guangdong is located in the tropic and subtropic climate region. Due to its unique natural condition, it has a wide variety of plants and produces many unique tropic material plants. The application of Chinese medicine to folk is more extensive than in the mainland. Professor Deng was a famous doctor in Guangdong. He inherited his TCM experience from his father and many famous doctors in Guangdong. He was accumulated more than 80 years clinic practice experience. He has developed a handy application of the source medicine and gradually formed a unique diagnosis and treatment characteristic. So that is why I think when we learn Professor Deng's clinic experience, we must remember which herbs he often used, which is unique experience, and which other practitioner very seldom use it. That is very important. So when I followed him in the past 20 years, so I found some of his unique practice, Cantonese local herbs or Lingnan local herbs. That is an important part of his academic thought and clinical experience. South China herbs more suitable to Lingnan region climate characteristics and is particularly suitable for the Lingnan, but South China herbs not only be applicable to Lingnan. According to the principle of syndrome differentiation diagnosis, these source herbs can be applied in any place, regardless the geographic North or South China, or even in the Europe, or even in the North American. So maybe you will say in Canada, in US, the weather is much different from Guangdong, and why we need to use this medicine. I think that is difference. Yeah, we always focus on the syndrome differentiation diagnosis. Even though the weather is different, but dampness is maybe in the Canada, a lot of dampness. Canada is a lot of lake and the sea in the both side of Canada. And the US have many cities near the sea, by the sea. Yeah, that's dampness. And the Western people, even North American, maybe is not hot. The weather is cold, but inside room can be hot. Use the air conditioner or central heater. Inside room can be hot. And Western people eating too much meat and drinking alcohol. Yeah, if drinking too much alcohol also can produce damp heat. Alcohol in nature is hot. Drinking too much coffee is hot. Alcohol is hot. And inside room, it can be, even outside is very cold, but inside room in the winter time still very hot. So many people can still produce damp heat. So no matter in which area. So these Lingnan local herbs If you find the patient is, your diagnosis is damp heat, you always can apply these non-local herbs to treating the damp heat. And you always can use the Deng category to treating the joint pain, treating arthritis. You always can use Deng Shi Wen Dan Tang to treating the coronary heart disease, to release angina, to release the metabolic syndrome. This is a laboratory research about 珍珠草 and 小叶凤尾草. The antibacterial effect of 珍珠草 and 小叶凤尾草 on common pathogenic bacteria of urinary tract infection. This work this experiment is I did this at before I come to UK, that is 2002, maybe around that, 2003, yeah. Maybe 20 years ago. 珍珠草 and 小叶凤尾草 were very common used by Professor Deng Tietao in treating the urinary tract infection. They have been used as a pair medicine called 针凤. In his prescription for treating the UTI, usually used as a first choice. This is 珍珠草 and this is 小叶凤尾草. To inspect the antibacterial effect of 珍珠草 and 小叶凤尾草 on common pathogenic factors of urinary tract infection, we use alcohol method to compare the antibiotic effect of the two herbs. Method and Mataran method. So 珍珠草 and 小叶凤尾草 was purchased from Hospital of Guangzhou TCM University. All were native herbs of Guangdong. They were decocted and divided and mixed up in 100% concentration. The control group with the 热令清 powder. 热令清 powder is the patent remedy, a powder for treating the UTI. All the medicine has been bacteria infection and diluted to the all the medicine has been bacteria disinfection and diluted into the concentration of 1 and 0.1, 0.25, 0.125 gram per milliliter. The experiment bacteria is these 4 bacteria. These 4 bacteria is commonly causing the UTI bacteria. The experiment material is nutrition agar and nutrition gravers and calf sperm. That is just a experiment bacteria. That is the technique. That is experiment method. I don't talk in detail about the experiment method. This is just a microbiology technique, very commonly. I just come to the result. That is result. That is a different concentration. 1 gram, half gram, and a quarter gram, and 0.125 gram per milliliter, a different concentration. This is a different bacteria. that is, it shows antibiotic effect of combination of 珍珠草 and 小叶凤尾草. For each bacteria, they have a good effect. And this effect is doses related. Look at this. This is the control group. This is 珍珠草 plus 小叶凤尾草. This is 珍珠草 only, and this is 小叶凤尾草 only, and this is 热令清, which is control group, is compare group. So 热令清. We can see from this 珍珠草 plus 小叶凤尾草 has the best effect in each of the bacteria. You can see this is 珍珠草 and 小叶凤尾草. The inhibitor, this is large, large hole here. It can inhibit the bacteria. It shows better effect. This is 珍珠草 only, and this is 小叶凤尾草 only. This is 热令清. And this hole is just nothing, no, just a control group. So you can see 珍珠草 and 小叶凤尾草 at this bacteria has the best effect is this group. And in the other bacteria, it also shows 珍珠草 and 小叶凤尾草 has the best effect. 珍珠草 only, 小叶凤尾草 only, 热令清 here. But 珍珠草 shows the best one. And the other bacteria, nearly the same result. And this bacteria, also say, 珍珠草 and 小叶凤尾草 get the best effect. So, urinary tract infection is the common disease in the clinic. The treatment of the Western medicine is mainly depend on the antibiotic and sulfanilamines. In the recent years, the bacteria has get more and more resistance to antibiotic, and the price of the new antibiotic increased greatly. The treatment of the Western medicine cost more but effect less. So Chinese herb medicine became the first choice for many patients. Many species of the bacteria can lead to the infection of the urinary tract system. The spectrum of the bacteria varies according to the district and times. It is reported on the 1,856 cases of UTI in Guangdong. The result showed the 4 most important bacteria causing the UTI in Guangdong is these 4 bacteria. This corrects of the pathogenic bacteria spectrum maybe is related to the damp heat in the South China. It is characteristic of the damp heat, Lin syndrome in TCM. 珍珠草 has a function of clean away the heat and detoxification, and also was diuresis function. The pharmacologic studies show that the mild component of the 珍珠草 and some other organic acid which have antibiotic function, including the 10 acid, acetic acid, and acrylic acid. The function of 珍珠草 and 小叶凤尾草 is clean away the heat. So the result showed A combination use of 珍珠草 and 小叶凤尾草 has a significant inhibition effect of the 4 common pathogenic bacteria in the urea infection. 珍珠草 with 小叶凤尾草 has a better inhibitor effect on the 4 bacteria. A conclusion, use of 珍珠草 and 小叶凤尾草 as a couple to treating the ureatric infection, which from Professor Deng's clinic experience has its scientific mechanism. It is worth for us to practice in the following clinical works. So let's sum up. We use about 2 hours discussing about Professor Deng Tietao's academic thought and his clinic experience. First, we're discussing about integrated Shanghan and Wenbing in his clinic practice. I take SARS treatment for example. Professor Deng treating the SARS at 2003. He used his formula combines Shanghan and Wenbing together. For example, at the early stage of SARS, he used Ma Xing Shi Gan Tang, that is from Shanghan Lun, from Zhang Zhongjing. He also, at the same time, combined some herbs from Shengjiangsan, which is very famous formula for pandemic disease from Wenbing, and also some herbs from Yinqiaosan, from Wujutong. So after the SARS, joined the SARS treatment under the supervisor of Professor Deng, SARS getting under control only in couple of months. So not like COVID at the moment, already 2.5 years, still have many cases. I think for the pandemic disease, Wenbing's formula sometimes is very effective, like Shengjiangsan, like Xijiao Di Huang Tang, like Sha Shen Mai Dong Tang at the recover stage, Xijiao Di Huang Tang treating the later stage, and Yinqiaosan at the early stage. So that is all the formulas from Wenbing. Second, we're discussing about cardiovascular disease. When Professor Deng treating the coronary heart disease, he used Dengshi Wendan Tang, which is based on the traditional Wendan Tang and plus Danshen and Dangshen. Because Professor Deng believes phlegm and blood stasis is the key points of the pathogenic change of the coronary heart disease. So he used Dengshi Wendan Tang, can effectively release the agena. And I also discussing some treatment about metabolic syndrome, like high cholesterol, diabetes, obesity, and high blood pressure. So Professor Deng also use modified Dengshi Wendan Tang, can help the metabolic syndrome. Thirdly, we're discussing about the treatment of the myasthenia gravis. Myasthenia gravis is quite difficult to treat in the Western medicine. Professor Deng used modified 强肌健力饮 for the, if he used the decoction, it's called 强肌健力饮. If this formula already has been made into the capsule called 强肌健力胶囊 to treating the myasthenia gravis. Because the muscle was dominated by the spleen, by tonified spleen and tonified qi can make the muscle strong. So 强肌健力饮 is based on the 李东垣补中益气汤 tonified qi and nourished the blood. Professor Deng used the big doses of Huang Qi and big doses of Wu Zhualong. The Huang Qi's doses can be over 60 grams and sometimes even over 100 grams. And the last, we're discussing the unique clinical experience in Lingnan local herbs or Cantonese local herbs. We mentioned Professor Deng's favorite herbs, Wu Zhualong, also called Wu Zi Mao Tao. Another name is Nan Qi, is a sauce Huang Qi. And we also mentioned some ingredients of Cantonese cold tea, like Gangmei Gen, Duzha and Long Li Ye, which has good function for clean the wind heat, used for the benefit thought and clean the heat, which is only used in the Lingnan area. And then we're discussing 真凤, 珍珠草, and 小叶凤尾草. I introduced the laboratory research, which I did about 20 years ago. So we use the microbiology technique to approve the mechanism of the 珍珠草 and 小叶凤尾草, how to inhibit the bacteria of the UTI. We also mentioned the Deng category herbs for treating the arthritis or B syndrome. We mentioned 宽筋藤, 落石藤, 清风藤, 海风藤, 鸡血藤, 鸡石藤, 忍冬藤, 夜交藤, and 雷公藤, many different kinds of Deng category herbs, which are suitable for treating the joint pain. And then we mentioned some herbs for pain release, like 两面针. Professor Deng called it 入地金牛. Under Xu Changqing, it was called 了雕竹. And 黑老虎, some herbs for release different part of the pain, and 救鼻鹰. So many Cantonese local herbs is very good at expel the damp and clean the heat. So even we practice in the Western country. So I'm in UK. The UK is Ireland. So it's surrounded by the ocean. And American and Canada also, East Coast and West Coast, all are ocean. So many cities just by the sea, including Toronto. So I think the weather always dampness and humid. So dampness is the same like a Guangdong province. But just it's not hot. It's very cold actually in Canada. Canada is very cold. But inside the room is usually can be hot because they use the central heating. And the dietary of the Western people more easy to produce internal heat. They drinking coffee, they drinking a lot of alcohol. They all produce heat. And meat, many red meat, easy lambs, beef, so often easy to produce heat. So damp heat is often can be seen in my practice. Even in UK, many people suffer from the damp heat. I think these Cantonese local herbs still can be selected. So Chinese medicine is experienced medicine. The longer practice, the more experience. Professor Deng, he has died at the age of 104. He practiced over 80 years, accumulated a lot of valuable knowledge and experience. So we should learn from him and to practice his theory in our future works. So I hope you can remember something from today's lecture. This is Times Square in New York. At the Chinese New Year of 2018, Professor Deng, he's at the advertisement for Deng Lao Liang Cha, is a Cantonese cold tea, which is produced from Professor Deng. So this is the second time he's on the Times Square. A few years ago, he has a first time here. And this picture shows is written by Professor Deng. He said, 21st century is the center of Chinese culture and also is the center of Chinese medicine flying up. He written this at 2001, at January of 2001. Thank you very much for your attention. If you have any question, you are welcome to contact me. I also has on the internet, I have a English academic blog called Chinese Medicine Forum. You are welcome to pop in my blog and read more information about TCM and acupuncture. So thank you again. Okay, goodbye everybody. Bye bye.